Good afternoon, everyone. I'm so glad that all of you have joined us, and thank you for joining our journey of upskilling healthcare, especially the nurses. And I think the restraints is something which we wanted to talk about because a lot of times the restraints are not implemented properly. So that's the reason we thought we'll take up this skill this week, and we will go through the best practices of using restraints. So this applies to both the doctors and nurses. The doctors were prescribing what are the things they have to take into consideration, and also the nurses while implementing it. So let me share the presentation. Okay, before I start, I thought let me just quickly, because we're talking about skills summit, you might be wondering what is the skills summit. So basically, skills summit is, I started it because I went abroad and found how empowered nurses are, in the West, and I was wondering how we could make nurses more empowered in India. And one thing which I thought I could do within my capacity is to give them knowledge and skills, because knowledge is power, and with power comes empowerment. So we have this vision for the 2047 vision, we call it, the 100th year of independence. How do we want our nurses to be? So one is, we want to nurture them by a learning and development culture. Right now, hospitals, the nurses do not have the nursing and development culture, mainly because of shortage of nurses, many other reasons, but they need to focus on the personal and professional growth. So we need to make the changes in the hospitals. And then the next is to upskill them by providing courses and programs to enhance the skill set of nurses. And that's what we are doing right now, and with the many courses which we're offering for nurses. The third R, the third letter of the nurse is R, and that is respect. So nurses should have equal respect as doctors, and they should feel valued and recognized for their for the contribution and growth of the healthcare in general. And the fourth letter in the nurse is S, and we want to strengthen the nurse's capabilities to navigate the roles with confidence and authority. And finally, E stands for empowerment. Empower the nurses to have a stronger voice, not only just for patient care, but also to direct the healthcare policies and practices in our country. So that is a vision for nurses in India, and hopefully in the next 5 to 10 years, this will become a reality. So today in the, when we talk about restraints, this is the agenda. I'm going to talk on 4 main topics. First, talk about what restraints are, what are the types of restraints, and then how we could avoid restraints. Then the third one will be about prescribing restraints. What are the things to take into consideration? And finally, the most important thing is how do we use restraints safely on patients so that they are not harmed. So restraints, applying restraints is very simple, but the decision to use actually is a complex one. And we should think in a lot before applying a restraint on a patient. So this should be a collective decision. The medical team, the patient, and the family members should be consulted before applying a restraint. And the restraints are useful, mainly to safeguard patients against injuring themselves, because they may not be in their full consciousness and they may make movements without their volition, but it definitely is a safe something we do to safeguard the patients, but that itself sometimes can be misused and it can cause harm, and sometimes it is also used to reduce the work burden. And needless to say that the restraint should only be applied upon a doctor's order. So these are all very basic things. And let me get into the definition. So what is a restraint? Restraint is defined as a physical or chemical means or device that restricts the patient's freedom or ability to move out. So this is the whole thing. So you are restraining the movement of a patient. So when we do this, it can be done by either physical restraints, as you can see in the picture, or by giving some medicines which will actually calm the patient down and therefore reduce the movement of the patient. So I wanted to stop here and ask, because this is slightly a little bit long-winded lecture, and not a very very difficult to make this interesting. So what I thought is ask you a question, and I want you to write in the comments, type in the comments, or raise a hand so that you can answer. What is the best type of restraint? Anyone can answer, please. Feel free to type it in the chat or question answer section. Yeah, somebody says tying hands. I think that's Dr. Deepthi. And Gopalda says chemical. Joseph says it's physical restraint. Yeah, physical, but what type of physical, I want to ask? Padded bandage. Yes. Physical restriction, chemical. Right, we have some answers. Thank you so much for responding. And Joseph says wristbands. Shailaja says bandage. And Shanta Lakshmi says by medicine. Thank you so much for answering. I want to introduce one, and in question answer, I think there are a few things. So one is Portia says sedation. Sashank says restraint with consent is the best. And Merlin says side rails. Okay. So side rails actually don't restrain the patient. They're actually safety device, right? So the best type of restraint is, there is somebody who says, Arivu, who says there's no such thing. Each patient is unique, and yeah, it's a very clever answer and very appropriate. He says you have to select the patient, select the restraint according to the patient. There is no such as best type of restraint. Okay. And many of you have said it is a well-padded, safe restraint. But I want to introduce you to this concept of least restrictive restraint. Okay. So the best type of restraint, it could be physical, it could be chemical, it could be, wrist, wherever you're putting, it could be in the ankle, but it should be something that permits the patient freedom of movement to the patient so that they are able to take care of the needs also. Okay. So one example is mitten. Many of you had put this in the chat box. So mittens is something where the rest of the arms are all are free, but at the same time they may not be able to use the fingers. So the best type of restraint, if at all you have to use restraint, is the least restrictive restraint. So that's something which I want to answer. So with that questions out of the way, let's do like the type of restraints. So what is physical restraint? It is a manual or physical or mechanical device or a material or equipment that physically stops the patient body from moving around freely. Okay. So it could be applying a wrist, ankle, or a waist restraint, tucking the sheet very tightly, side rails and an enclosed bed, and hand mitten. These are all types of physical restraints. Okay. So side rail is actually one of the least restrictive restraints because it allows all the movement, but it prevents the patient from falling down. Okay. Similarly, the hand mitten. Okay. So this is the physical restraint. And tucking the sheet very tightly, I remember one of my consultants saying that, his wife used to be a nurse, and every time he goes to the bed, he feels very restrained because because she makes the bed as if she's making a hospital bed, and he can't even move his feet. Okay. So even a tightly applied bed sheet can be a good restraint. Now, chemical restraints are defined as any drugs that are used to restrict a patient movement, for example, haloperidol, morphine. And in this particular lecture, I'm not going to talk about chemical restraint. It will be all about physical restraints. Now, we have to differentiate physical restraints or chemical restraints from a safety device. Okay. So safety device or a protective device is used along with the treatment. For example, this international in I mean inter-IV board, which we use in children or in adults, sometimes if it is across the joint, is one example of a safety device. You should not confuse these safety device with restraints, because restraints are applied to patients who cannot take care of themselves and whom we want to safeguard. This is actually part of the treatment where you also put it so that the device stays in place. So that is safety device. Now, preventive measures is actually defined by the Centers for Medicare or Medicaid Services. It is defined as things that are done to prevent use of restraints. Okay, so they want hospitals to be restraint free. So that is the goal of this particular preventive measures. So before using restraints, you try and implement these preventive measures of using restraints, so that the restraint use goes down. So that is the concept of preventive measures. Why we have to be careful about restraint is sometimes patients or the relatives can go to the court against the hospital or against the doctors, because it can, this is a civil, criminal thing. False imprisonment, you may be booked under false imprisonment, which is the unlawful restraint of an individual's personal freedom or unlawful restraint or restriction of an individual. So there is a legal issue here. So you have to be all aware about. So when you are using restraints, you have a medical legal issue. So that is the reason you have to be very, very careful. So what are the indications for using restraints? So there are only two main indications. The first indication is we use restraints to protect the patient from injury or from unnecessary harm or risk. So this is the major indication, or majority of restraints are used for this indication. Patient may be confused, not able to be conscious and knowing what they are doing. They may pull out their NG tube, they may pull out the endotracheal tube. So you are doing to prevent injury or unnecessary risk or harm for the patient. The second indication, as I said, is prevent removal of life support connections such as endotracheal tubes, arterial lines, central lines, etc. This again happens mainly in the intensive care because patients are agitated, they're not fully conscious. So without knowing, they may do these things. So these are the two main indications: preventing harm and preventing removal of life support systems. All the rest are only relative indications, and you should try and avoid restraints in those indications. So how will you ensure that restraint is applied only when indicated? So you need to always have this attitude that restraints are the last resort. Don't try and do it as a immediate reaction, and adopt preventive measures such as constant reminders, not touching the line, changing the medications if possible to make them calm, and talk to the patients if possible, or at least to the relatives. And maybe you can ask one of the relatives to stay by the side of the patient so that you can prevent restraints. I mean, each hospital can have their policy. So these are some of the things which you can try to prevent restraints. What are the contraindications? Contraindications is routinely it should not be used as in the delirium management, because in delirium, if you immobilize them, it increases the agitation and therefore increases the risk of injury. So it should not be prescribed as a routine treatment for delirium cases, and never be used because there is short staffing or staff convenience, or sometimes very, very, this is very difficult to discuss. It could be used as a patient punishment. So when I was a student, I have seen alcoholic patients who come in the night. They are bashing about, doing all sorts of things, and the restraints are used first to restrict them. But then, because they've been giving so much of trouble to the healthcare staff, sometimes it is prolonged as a punishment. So this is very bad and should not be done. So let's go to the next question. Again, I'm asking this the best and all those things. So what is the best practice for implementing restraints? Let's see if some of you can answer this question. What is the best practice for implementing restraints? Please use the chat box, question answer, no, whatever you want. Okay. Avoiding restraints is the best practice while you are implementing restraints. Okay. So I already touched upon this. Avoiding restraints is the best practice. If you're a hospital, in a last month, you can actually put up in your safety committee meeting how many restraints you used. The less number of restraints you're using, actually, that is the best practice, right? Because you're having a policy, you're training people, and you're actually trying to reduce the number of restraints. So why should restraints be avoided? Let's answer this question. So because of the complication. One reason is restraints leads to complication and quite a lot of them. Let us look at it. So it could be organ systems, like because you're immobilizing them, they may get pneumonia, they incontinence, urinary tract infections will come, all because of stasis. Tissue viability is a problem. Many of you touched upon this, isn't it, in the answer? They can develop pressure ulcer, tissue damage due to constant friction in where you're putting the restraints. Lot of musculoskeletal problems, brachial plexus injury, if you're putting it across the axilla, deconditioning, and then of the muscle weakness, foot drop, wrist drop, all nerve damage, and maybe bone dislocation because they're agitated and you're restricting them. Sometimes they can lead to dislocation, nerve damage and ischemia, and then I think this has been wrongly done. Vascular, physical is immobility, reduced appetite, dehydration, sometimes even death happens. So this is a sentinel event. If a restrained patient's death happens, then it becomes a problem. You need to have an inquiry on that. And very important is the psychological and emotional disturbances, increased agitation and hostility, fear of humiliation, feelings of humiliation, loss of dignity, increased confusion, and psychological distress. So restraints, the self-respect of the patient is being challenged. So this leads to a lot of psychological and emotional problems. So much of complications. That is one reason you should avoid it. Major reason you should avoid restraints. So how do you do? You need to have a hospital-wide policy. Train people is mainly the outlook. There's nothing much to train, in terms of skills or anything. It is the outlook training where, as much as possible, you try to reduce the restraints and implement alternatives for preventing and management problem behaviors, and individualize. One of you pointed out, individualize the treatment according to the patient's needs. And you can have probably exercise programs, personal assistance devices, including hearing, visual, and mobility aids, and environmental. This is a new thing which is coming. You put them into special rooms where you have video monitoring and many other safety devices possible with comforted pillows, cushions. Make sure there are no sharp objects around them, leg separator pads, and improve the lighting, eliminate fall hazards. And you could even put alarms. If they change the position, an alarm will go about and the staff can immediately attend to the patient. Okay, so these sort of mechanical or electronic devices can be used to avoid restraints. So much about the introduction and how to avoid restraints. Now we are coming to the actual practice of prescribing and using restraints. So before prescribing restraints, we need to have a team approach. So you need to assess the need for the restraint. Very important to get an informed consent. Mostly the patient may not be able to give the informed consent. Therefore, you should take it from the nearest relative or the legally who is the guardian for that particular patient. And as I told before, choose the least restrictive measure. So here is a model where you need to have a warning saying that this has to be used only in cases necessary. Reason should be always stated. What is the type you tick here? Now, after prescribing, it is the responsibility of the doctor to regularly review and also the nurses and discontinue restraints at the earliest possible time and keep documenting the relevant information. So, one of the orders you should never write for restraint is a standing order. No, like you can't say, do restraints SOS or restraint PRN. You cannot do that because the restraint has to be, need has to be assessed, consent has to be taken, and then only it can be implemented. So never write a as PRN or as needed basis for restraint. Now, I'm coming to the next question, very important. How long is a doctor's order for restraints valid? I'm inviting answers from you. How long is a doctor's order for restraints valid? 24 hours seems to be the common answer. Almost all of you are answering 24 hours. Minimum 1 hour to 2 hours. Sri Lanka has given that answer. Every 1 hour to 2 hours, the doctor's valid. Most of you are saying 24 hours. Yeah, almost majority. There is one answer says 3 days. Yeah, reassessment has to be done. No, and no doubt about that. I'm asking in your hospital, if a doctor writes the order, how long is it valid? And most of you are saying 24 hours. Well, that's great. That's what most of us practice. No, I fully agree with that. Right? But I wanted to give you some new information. Now, one thing you have to remember about restraint is this is one condition in which the doctor's order will automatically expire. Okay, you should have a hospital policy, set the time limit for the restraint order given by the doctor. This is mainly to prevent, that you forget and the patient has unnecessary injury or unnecessarily restraint. So, any order for restraint will expire at a certain amount of time as per the hospital policy. And nobody can continue the restraints or apply a new restraint without a new order being written. This is a very, very important part of doctor's prescription for restraints. Now, again, as I told you, the Centers for Medicare and Medicaid Services has given guidelines which is followed in most of the Western countries for restraints, and I'm quoting that. Whether it is practical or not, you decide for your hospital. Okay? So, for adults, the order must be renewed every 4 hours. Okay, this is the guideline. So every 4 hours you reassess, and then you have to renew that means the doctor's order will expire every 4 hours. For children and adolescents, that is adolescents from age 9 to 17, the order must be renewed every 2 hours. And children under the age of 9, the order must be renewed every 1 hour. This is the guideline. This is the best practice. Okay. So this is something I wanted to share with you. This is not my guideline. This is Centers for Medicare and Medicaid Services. Just because I learned a lot for this particular webinar. I'm actually not someone who prescribes restraints very regularly. So I read up the literature and went through the thing available, literature available. And this is quoted in most of the journals, articles, or guidelines which are written about restraints. This Centers for Medicare and Medicaid guidelines. So this is something I thought we should have it in mind. So adults every 4 hours, children's they divide it into less than 9 every hour, 9 to 17 is every 2 hours. So that is about prescription. Now let us come into using restraints. So what is the nurse's role? So one is assessment and regular review. Regular review meaning whether this restraint is needed or not. That is the main question. And also we need to monitor the patient. Shared decision making. The nurse is the best person to know what are the wishes of the patient's relatives and all that. So the nurses help in shared decision making. documentation, ethical restraint use. Here, the nurses plays the role of the patient champion. Always, in restraints more so. So the ethical use of restraints, you become the patient champion, and you stand for the patient because the patient cannot take care of themselves. So ethical use, restraint use is very, very important role of the nurse, and maintaining a safe patient and environment when you're using restraints is also the nurse's role. So one thing you have to do before placing the restraint is patient placement. So check the doctor's orders, lock the patient bed in the lowest possible height, and position the patient properly for proper body alignment. Before putting the restraint, you have to make sure the body alignment is in the natural position to prevent any neurovascular injuries. So if it is an abnormal position, there's always or if the patient is moving and the restraint are not properly applied also, they can lead to nerve injuries. So very, very important to be conscious about how the patient is placed in the bed before applying restraints. Now, another thing we have to notice, to clean and dry the skin folds prior to application of restraints. Choose physical restraints. Now I'm using the abbreviation PR, physical restraints, based on the patient's size. There are different, some may be adjustable. And if you're using a restraint used by reuse it, make sure it is cleaned properly. Proper technique as per the product instructions. If you're using it over bony prominences, those have to be padded to prevent tissue injury on skin ulceration. Okay. And you have to ensure some amount of mobility. So try to restrain at the most 2 limbs and not more. Very, very rarely should you actually restrain all 4 limbs simultaneously. And the restraint should be connected to the bed so that when the bed is moved, you don't need to readjust the restraints. Very important. Okay. You should not apply it in such a way when you change the position of the bed, the restraints become more tight or anything like that. So it should be applied to the bed so that it moves along with the bed positions. And avoid applying the restraints on top of catheters because that can block the catheters. So always the restraint should be down and the catheters should be on top of them. These are all some tips and tricks which you need to know. Then come assessment and document. Regularly assess the body surface and the patient. Untie the restraint every 4 hours and document the relevant information. What are some precautions? Don't apply them very tight. And very, very important, secure it in a way that the knots can be removed for emergencies. So that's the reason these type of proprietary or commercial restraints are very useful. They just, you just unclip them and you can remove it. If you're using a homemade restraint where you're knotting 2-3 times, and imagine the patient is having some emergency or a CPR, very, very difficult to undo these restraints. So you have to keep that in mind. And what is the monitoring you have to do on restraints? So initial monitoring should be every 15 minutes for the first hour. Once you apply the restraints, there should be a standing order for every 15 minutes for the first hour. And after the hour, the patient is stable, then 4th hourly for adults, 2nd hourly for children from 9 to 17 years, hourly from children less than 9 years. So some studies recommend the monitoring of elderly patients using a closed circuit cameras or direct observation. So in addition to this, you need to have a CCTV monitoring, especially for elderly patients. Okay, because you don't want them to get into trouble. Now, what are the parameters to be monitored? One is the physical status, vital signs, hydration, nutrition, circulation, range of motion, and of the limbs, hygiene and elimination. You can't put a diaper or something and allow them to be in the restraint. You need to keep checking that. Physical comfort, safety, and any injuries. Emotional status. We already talked about it. Patient dignity. Are you violating the patient rights? You have to ask yourself. And Every time you monitor them, ask yourself, can this restraint be discontinued? Or can a less restrictive restraint be used? And before applying or removing a restraint, make sure it is in the correct and safe manner. So these are the things to be monitored every time, and that I told you, every 15 minutes or every 1 hour or every 4 hours. These are the things which have to be monitored. Finally comes the documentation. The first thing you have to document is why you have used the restraints. So whenever it comes to an issue, even if they go to the court, if the indication is correct, then you will not be in trouble. But this indication has to be documented. So the reasons for the physical restraint use has to be documented clearly. Consent of the family, patient, or surrogates for the physical restraint use should be available. And the medical order, what should it contain? Details of the time the physical restraint was applied, when was it removed, the number of limbs which were restrained, what was the devices used, and all these should be documented. Again, I'm emphasizing PRN, that is as necessary order for restraint should be avoided. And other thing, not only should you write reasons for physical restraint use, you should also state what are the preventive measures. I told you, preventive measures are the measures used to prevent using restraints. What are the methods which were applied and why was it unsuccessful? Should also be documented. If you document all this, your documentation is rock solid. So that is what you should do. Okay. You should also note the physical and mental conditions before, during, and after restraint use. And how do you assess it? Process of this assessment also should be mentioned. How do you assess physically? How did you assess mentally? What tools did you use? Should be available. And what is the patient response? Does the patient become more agitated or the patient actually benefited from it? And I previously told, if there has been any injury or death in a period from the beginning of the restraint use to 24 hours after its removal, it is considered as happening during restraint use. So suppose you used from 6 a.m. to 12 p.m. today, then if the death happens the next day, it is still considered as restraint and death happening during, or even if any injury. You detect the injury within the 24 hours, it is considered as happening during the restraint use. Whether it is because of it will be later decided, but you have to document it as during restraint use. So friends, I think that brings us to the end of this short, I would say learning, because it has been learning for me, preparing for this talk about restraints. A lot of, important things we learned. So in summary, we looked at the types of restraints, physical, chemical, and then preventive measures to be used and to avoiding restraints. So why should you avoid restraints? Because of the complications. And what are the best practices to be done? What are all things you can do to avoid restraint use? We looked at that. What are the best practices in prescription? And we talked about the automatic expiry. We talked about the guidelines on how long the prescription should be valid. So that is also we looked at. And finally, we looked at restraint use, both the application, the monitoring, and documentation. All these we looked about. So thank you so much for your patient listening.